So, how are laminopathies diagnosed, and how common are they? Laminopathies are relatively rare in incidence, affecting only 3 to 5 people per 100,000. As of right now, laminopathy diagnosis is based on suggestive clinical features, symptoms, and genetic testing. Some of the symptoms of laminopathies are cardiac manifestations and the presence of contractures. Despite some laminopathic diseases being autosomal dominant in nature, the diseases are rarely transmitted between generations. Instead, the diseases result from spontaneous mutations in the LMNA gene, often in patients with no family history of the disorder. This can cause genetic testing to be unviable and unreliable in the diagnosis of many laminopathy cases. It has also been discovered that the cells of individuals suffering from laminopathies contain cytoplasmic PML particles. These PML particles are normally found within the nucleus. However, in laminopathy individuals, they end up leaking into the cytoplasm due to nuclear rupture. Research on whether or not cytoplasmic localization of PML particles can describe disease progression is still ongoing, but it may be possible to use this research as a diagnostic and disease progression model. So, what research is being done to learn more about laminopathies and help treat those suffering from these disorders? Going back to our first patient, Sam, he was diagnosed with Hutchinson-Gilford progeria syndrome. Successful therapeutic strategies for this disease have been provided by using farnesylated transferase inhibitors, RNA interference, and modified oligonucleotides. This laminopathy is a result of the accumulation of permanently farnesylated pre-lamin A, which no longer became mature lamin A protein. By using farnesylated transferase inhibitors, the buildup of pre-lamin A is hindered. RNA interference and modified oligonucleotides can also be used as a therapy, as they are complementary to the mutated lamin mRNA transcripts, so they can interact with and degrade them. Unfortunately, these current therapeutic efforts require large multidisciplinary teams of medical professionals and can only delay the onset of complications and symptoms. The goal for the future research is to prevent the onset of complications completely and potentially reverse the effects of the disease. One of the most promising ways to do this is via gene therapy, which would involve designing and applying small peptides or other molecules to correct mutations in lamina genes, and also prevent protein-protein interactions with mutated lamin proteins.
Created using Powtoon.